In this video, I want to talk about the topic of issue framing, how problems get recognized, get on the agendas of public policymakers and decision makers. The whole question about recognition and framing or reframing of issues over time. It's a fascinating part of public policy and the politics of public policy, and for anyone, whether they work in government or another public authority, or certainly if you're working in a community group or particularly a social advocacy group or social movement, the whole idea of how to frame issues and how to mobilize energy around them and how to capture people's attention and awareness of an issue are central to doing contemporary policy analysis and social change. The recognition of problems, or how do private troubles become public issues, to use C. Wright Mills' old terminology from his book, The Sociological Imagination. How do private troubles become public issues is the stuff of literature on agenda setting, problem recognition, and issue framing across a lot of disciplines and fields in the social sciences and humanities. But problem recognition can be simply described as when there's a felt sense by a number of people, and the number, how big a critical mass is necessary. There's no magic number on this. It really does vary from community and to topic and to issue and context, but there's a sense that something is wrong, whether that's a strong, explicit sense or just a sense of malaise or a vague sense of trouble that's brewing in a community or in a particular segment of society. That there's some new situations looming, or that there's some possibilities for improving upon the state of affairs in the community. Sometimes this is triggered by a dramatic crisis or emergency. It might be the stuff of headline news in a newspaper, investigative journalism. It may simply be the latest statistics published by a government agency on the state of unemployment in the community, or that, yes indeed, the economy has fallen into an official recession. So there's all sorts of statistical data or indicators that get published on caseloads and on outcomes and health outputs and the status of a community's well-being and the challenges faced by groups within that community. Any number of those sorts of indicators can trigger greater attention to an issue, move it up the policy agenda, so to speak, in the attention cycle of governments, and certainly if the mass media moves behind it, it really can get some momentum in terms of converting some troubles much more into publicly recognized issues. The next challenge is to whether whose responsibility is it then to respond to those issues. And for many groups, they're looking primarily at government agencies or public authorities to respond to issues that they regard to be about matters of injustice or inequities or public policy responsibilities of a provincial and or a federal government. Often getting those issues recognized and the problems defined obviously involves gathering data or evidence, collecting information, people constantly being challenged to provide more evidence for evidence-based decision making, which is the rallying cry of the times we now live in, and to try to, in a very traditional sense, persuade others. So still, issue definition, issue framing, and problem recognition involves the classic Greek notion of rhetoric, using language to persuade and to make a case that wins over allies, perhaps neutralizes opposition, and builds support behind the case that or cause that the group is working on. In addition to using so-called hard information, there's also the so-called softer information of anecdotes, personal stories, lived experiences. Good investigative journalism is a great example of how that can be mobilized around an issue. How families are struggling with cutbacks or struggling with wait lists for services, to point out the stark gap between what might be the warm words of a government official or a cabinet minister, the rhetoric of a government reassuring the public, and the harsh realities and the daily struggles that many individuals and families may face. That shows a great gap exists between the language used by government, the rhetoric used by government, and the everyday life and the realities of many individuals and families. This area of issue framing and problem definition and recognition is also full then of very many powerful personal stories, personal lives, as well as perhaps very high-level aggregates of statistical data of broad categories. It also involves the use of symbolism and metaphors, narratives. Stories are always important in policy making, and certainly here. They all go towards shaping arguments to try to capture the attention and to move along public awareness, and also political attention and action on a given issue. There's also what we call policy entrepreneurs, the so-called movers and shakers, the opinion leaders. Many policy entrepreneurs are located within think tanks or professional associations or large organizations that are devoted to working with government relations. And they're always looking for the opportunity, the window of opportunity to see where there's a congruence of issues and problem awareness and information or evidence and a solution at hand which the group can then try to put forward as the answer to the prayers of a government facing a crisis or facing insistent demands by an angry public or a very concerned population to do something about a given problem. So groups, just like governments, have opinions about policy instruments and which ones may be best to mobilize in tackling a given problem. In a lot of the literature you may read about problems, problem definition, how issues get recognized and then in turn get framed. In simple terms, we can say there's two underlying different philosophies or worldviews as to how to describe and understand these processes. One comes classically out of a rationalist model, both in the social sciences and in philosophy, that there's a given reality out there, there's an objective truth, and that facts speak for themselves, and with the right kind of investigation, we can discern what the problem is, we can enumerate its various characteristics, and then we can generate some options to tackle that given problem, and that people will generally agree on what the issue is, and they may disagree on the means, but that there's some clarity and certainty around both the problem at hand and what the ultimate objective may be in reducing or eliminating that problem. A lot of politics still may use that kind of language, but quite honestly, in my opinion, most politics engages in a much more of a social construction of reality. That there'll always be competing or contending perspectives and opinions on what the issues are. Not only that, there'll be competing views on how important a given issue is in relationship to others. There'll be also debate over how different issues interrelate and get bundled up into different packages, and what the overall label or image may be given to a problem, whether in the ultimate terms one wants to label it a health issue, or a law and order issue, or a housing issue, or an income issue. So when we get into things like the social determinants of health, there's a whole array of competing ideas and factors at play that at one level they're all interconnected, but in making sense for advocacy purposes and in mobilizing action around problems, they tend to get broken down into categories and designated because they're relating to governments that are very much still compartmentalized in different portfolios, program areas. So whether it's going to be a minister responsible for housing that takes on an issue, or the health minister, or attorney general, or the social services minister, or all of them, really will affect how the problem gets framed, how it gets taken up, and how it will actually get resourced and mobilized along the way, and what policy instruments may get picked up to be used to address the issues as it's been framed. So there'll be elements of rationalism in there, but there'll always be jostling and colliding of views and problems. There'll be contending perspectives, honest disagreements, as well as very calculated tactics in trying to get a problem framed in a way that advantages particular interest over others. So this is quintessentially a political topic. Also, issue framing has a history to it, and it can evolve over time. Let me give the example of childcare policy in the Canadian context. There was a lot of mobilization by the women's movement and other groups in Canada through the 1970s and into the 1980s, to the point that the progressive conservative government of Brian Mulroney in the mid to late 80s made a commitment to a national childcare strategy for Canadian families. It was going to be a federal provincial agreement. Several $1 billion over 5 to 10 years was committed. It did not pass because of an election came up in 1988 when the Conservatives came back into power, winning that election. They then started to soften their position. They reframed it that they were still committed to the idea of a national strategy for Canadian families with young children, but they would do it when budgetary resources permitted. So they started to frame it more within a fiscal framework of budgetary imperatives. By the early 90s, in the last few years of the Mulroney government, it started to get reframed as moving away from a universal commitment to a broad national system towards a more selective target approach, which had been the traditional approach to childcare provision in Canada in the first place. But by the early 90s, Conservative cabinet ministers in Ottawa were saying that we didn't want to pay for so-called the yuppie couples, so the young urban professional couples who could, according to this framing of the issue, could surely afford to pay for quality childcare if they so wanted. And why should they be subsidized as against, say, lower income Canadian families? So a rather narrow, far more residual conservative approach to framing the issue. Then the Chrétien government came to office in 1993. They faced strict deficit problems till about 1997, but as the budgetary restraints eased, many childcare advocates and family groups looked to the Chrétien Liberal government for some renewed leadership on early childhood education and childcare. And by around the year 2000, into the third governments of the Chrétien government, there were commitments by Liberals about talk around yet again a national childcare strategy, a national childcare approach. This was coupled with a national children's agenda, which both the provinces and the federal government renewed their attention to in the late 90s and early 2000s, trying to address poverty of children in low-income working families. And so there was a concerted, collaborative effort by federal and provincial governments to talk about children and a children's agenda. Almost invariably then, the child care issue got reconnected to that talk of a national children's agenda. And by the early 2000s, the Liberals were talking about the idea of a national strategy again for childcare across the country. By the time Paul Martin became Prime Minister in 2004, he was talking about the need for a national childcare strategy, comparing it to the introduction of Medicare, public health insurance in the 1960s, as the next great social policy project facing Canadians. And he referred back to his own father, Paul Martin Sr., who'd been in early Liberal governments of Lester Pearson and Louis Saint Laurent. And some of the major social policy achievements of that generation of Liberals. And Paul Martin Jr., when he became Prime Minister, tried to put childcare into that historic context as the next major social policy initiative. So framing it both in an historical and a political party sense, and as a major social policy project facing the country. In 2006, Paul Martin lost to Stephen Harper, but before they lost, they had put into place across the country federal provincial agreements on early learning and childcare, which was to begin to invest over the next 5 to 7 years in building up regulated quality childcare spaces across the provinces and trying to build capacity in those provinces that relied more on not-profit or for-profit or unregulated informal forms of childcare. When Stephen Harper came in 2006, they announced their intention to cancel those agreements, which they did within the first year, and they replaced that with a cash benefit. So they selected a federal spending program called the Universal Child Care Benefit, which is $100 a month for families with young children. And the rhetoric they used, the framing they used, was to get away from these large top-down systems that they implied the Liberals were proposing, and that suggested that professionals knew best how to raise children and that regulations were best, but to allow families choice and to give families a variety in choosing that by giving them the money to decide how and where and when they may use that for child care arrangements. So that shows framing of an issue over a long period. It also shows how issues get affected by changes in governments, changes in leaders, and the ups and downs of a social movement like the child care movement that certainly had lost much of its political clout by the early 2000s compared to perhaps some of its mobilizations in earlier decades. But it shows that issue framing and problem recognition is always a political affair. So thank you for listening.